Dr. Turner, founder and developer of QNRT, Quantum Neuro Reset Therapy. Today we want to basically go through 3 principles of QNRT for the practitioner so that we may provide some compelling reasons why QNRT would be a great adjunct and an addition to your practice. We feel that this is a method that you can incorporate within whatever system that you're using so that you can obtain better results and help your clients in a much greater way. Well, to get started, let's talk about what we know for the reasons why people do get sick. And we know from research that one of the reasons can be genetic. And certainly that's an aspect of science that is greatly improving. At the same standpoint, we may be dealing with methylation issues and some other aspects of some deep-seated rooted issues as it relates to a genetic predisposition for that illness. We also know there are many other factors and many larger and greater factors that may be affecting our client's health. As this slide basically states, each one of these, as we go through these 4 foundational reasons why our clients are sick, each one gets bigger and greater as far as more prevalence and more common reasons why our clients get sick. Disease, this will include all the different infections and the toxins that our clients are exposed to. We know in working with clients that many of our clients really have damaged detox pathways, and so we are having to address that more than ever. Being in practice for more than 25 years, I have seen this greatly increase with the type of situations and the clients that I work with. Trauma is another major big factor. Our clients may have been involved in car accidents or have received traumas to their body as well as brain, and this can be a large contributing factor for why our clients are not either responding or having difficulties getting well. The last one, according to all the research that's out there, it will tell you that the emotional stress, or what we call emotional dysregulation, is one of the greatest factors for the reason why our clients are ill, unable to get well, and certainly resistive to the treatment plans or the treatment care that we may be giving them. So taking that into consideration, we need to know that if emotional stress, and if that's a question we need to ask, could be a contributing factor for our clients not doing well or why they're very difficult in the treatments that we're giving them, then we need to address that in some way or fashion. We're going to go over how in this emotional dysregulation the hypothalamus is highly active and very much involved. It will certainly contribute to that sympathetic overload that occurs within the brain and the nervous system, and the stress responses will be heightened when that hypothalamus is involved. The hypothalamus receives information from the receptors of the skin, muscles, and organs, and if these are damaged, then we're going to have troubles in that area of our brain as well. The spinal cord, thalamus, and hypothalamus are all part of that circuitry that we are utilized within our periphery of our nervous system communicating with our brain. And the last 3 pathways that the hypothalamus is also actively involved is dealing with the endocrine system, appetite, suppression, and the need to eat, as well as the reticular activating system. These are major aspects of our nervous system and our overall health that's important for us to have in balance. So some of the evidences that we have seen with our clients, as well as you've probably seen with yours, the evidence of emotional dysregulation, there will certainly be certain body distortions. When people are dealing with stress, they'll have certain posture positions, shoulders will be hunched over, there'll be many signs and symptoms that something's going on. And you know that because we'll look at someone, maybe even someone outside of our clinical practice, maybe a family member, and we can tell something is wrong almost immediately just by looking at their posture and the way that they're breathing. This is a postural distortion that we will see on observation in seeing if a client is having emotional dysregulation. Pain. The research tells us that many times chronic pain is related to early childhood stresses that happen early in childhood that then manifest itself later in life. Visceral dysfunctions. our emotions are held within the visceral part of our body. So that includes many of the digestive issues that we may be dealing with, have also direct connections to that hypothalamus. Muscle contractions and weaknesses are apparent when our body is not balanced and our brain is not balanced. Here, as I just go through this evidence, this is an interesting study that was done back in 1917 by a physician that was documented by Dr. McKenzie, who basically found these particular issues as related to the clients that he worked with when there was that dysregulation within the body. One of the studies that's now current and is the largest healthcare study that's available for evidence of the emotional trauma contributing and being directly linked to the health of our clients as well as the health for us as it relates into adulthood. Here's the website. I challenge you to go to this website, www.cdc.gov, and actually look up this report. Again, it's a large study. It has lots of evidence and lots of research that was done. And if you've never heard of that study, it's really one that you want to know because, as I said, it covers this whole emotional aspect. I cover this in detail in our presentation, the QNRT introduction, and this is for anyone who just wants to know a little bit more of what QNRT is and what is the foundations of why it was developed. I will cover a few things that are important to know because if we're dealing with the hypothalamus, we're also dealing with the limbic system. And this is an area of the brain that we need to know more about because if we're talking about childhood traumas as being a major aspect of why we may be suffering certain dysfunction within our body, then we need to know why is that the case. So the limbic system response was never intended to be activated by a child, and we're talking somewhere around the age of 12 to 14 or below, is that we do not have the capabilities from a brain standpoint to handle the stresses as an adult. So our brain is not fully developed, and that's one reason why we can't handle extreme stresses in that early development years. We also need to know that we don't have a full set of neurotransmitters for protection, and we need those neurotransmitters to deal with the stress hormones as it relates to cortisol, epinephrine, and norepinephrine. The neurotransmitter protects our brain with those surges so that we're capable of reacting and responding to the stress in the right appropriate way. The other reason why our limbic system was not intended to deal with that type of stress as a child is that we do not have the capabilities of a fully developed cortex brain to handle this type of stress. So unfortunately, what the normal response is being emotionally paralyzed. Is a child who's under stress and unable to deal with it will not normally react in a fight or flight mode. They'll normally cower and shrink in such a way that they'll withdraw within themselves. Looking at the ACE study, what we're also seeing that based on these childhood traumas, and they're called ACE events, which is an adverse childhood experience, that in this study, based on hospitalizations for autoimmune disorders, it was determined that through this study that if one ACE event was prevalent, and that type of stress will typically be something related to neglect or abandonment, some type of separation within that family related to divorce or separation or addictions, and or any type of mental or social or physical abuse. That would be classified as an adverse childhood experience. But in this study, it was found that 64% reported at least one ACE event related to an autoimmune disorder. And it increases as more events occur within that early childhood. If there were at least two events, it increased the chance of an autoimmune disorder by 70%. An 80% chance or risk increase for myasthenia gravis, which is an autoimmune disorder, now when they've had two or more events. And lastly, this last statistic is astounding, that 100% increased risk for rheumatic diseases based on early childhood emotional traumas. This tells us that certainly there is a link to emotional stress. This last statistic, 100% increased risk for rheumatic disease, is quite significant in the fact that early childhood traumas have a lot to do with the pain syndromes and inflammatory disorders that one can experience later in adulthood. So in conclusions, based on this report, the conclusions state that childhood traumatic stress increased the likelihood of hospitalizations with a diagnosed autoimmune disease decades into adulthood. Not only that, these findings are consistent with the recent biological studies on the impact of early life stress on subsequent inflammatory disorders. We as practitioners are dealing with many conditions as it relates to that inflammatory condition. We're dealing with autoimmune diseases of the thyroid. We're dealing with pain and inflammation as it relates to joints. We're dealing with sensitivities, and on the list goes when it relates to inflammatory disorders. We know that is the number one issue as it relates to dysfunction and ill health and degeneration of the nervous system and the rest of the body if inflammation is a predominant factor that our clients are dealing with. Scientists finally show how your thoughts can cause specific molecular changes to your genes. A researcher, biologist, and geneticist, Dr. Bruce Lipton's research illustrates that by changing your perception, your mind can alter the activity of your genes and create over 30,000 variations of products from each gene. This is astounding that our brain and the way that we think can literally change our genetic structure. He further goes on and says the function of your mind is to create coherence between our beliefs and the realities of our experience. This statement is profound by saying your mind will adjust its biology and behavior to fit with your beliefs. And from this statement, we go to the first principle in QNRT. Our brain and our nervous system will adjust its physiology and responses to fit with our congruent beliefs. This is literally saying that if our congruent beliefs that we believe to be true are not really true, but our filtering system has been damaged, that now our physiology will change based on those beliefs, and our nervous system and brain will compensate and be out of balance as a result of this. This is astounding, and it goes exactly as we went through those 4 reasons why clients get sick and why the research states that the emotional stress or that emotional dysregulation is the largest contributing factor that your clients are dealing with right now in trying to get well. And if they can't pass through that and establish new congruent beliefs, then their brain and nervous system will just dictate the physiology to be what it wants it to be based on that situation. The second principle is that our brains are hardwired even before birth. In other words, before we're even born, that our brain is developing, and the early developing brain is developing what we call the limbic system. This is that automatic reaction part of our brain that is for physical as well as both emotional survival. The way this works is that your cerebellum, which is an aspect of your brain in the back of your head, senses unsafety and imbalance. And in that case, it's going to send a signal to the thalamus gland, which is part of the limbic system. And in this signal, the thalamus is going to try to determine, is something wrong? If something isn't, then it passes through and it no longer is going to activate anything into that limbic system. But if it's not sure, or if it really thinks that there is something wrong, then an intense current is going to be sent to the amygdala to basically say, yes, I am in danger, and I need to remember this, not only for the current, but also for the future, and it's going to burn a neural memory structure within the hippocampus, and a new neural structure is formed. The reason why this structure is formed is so that it can now protect you in the future. The hypothalamus is then activated in a fight or flight response. And once activated, it's now ready to take action quickly. And not only is it going to try to take action quickly the first time, it's going to now have that memory from this point forward to even be quicker and respond sooner to anything that's similar to that stress event. And that's the way our brains are wired. It now is programmed to react automatically, and any similar stress event becomes an automatic reaction. Our limbic system is for survival, no doubt. and it is very helpful for physical survival. If we take the situation that we were to touch something hot and we never done that before, we're going to feel the pain of that burn. And the next time we get near something warm, we're going to be pulling away quite quickly. But your brain can't tell the difference between an emotional pain and a physical pain. It's going to try to protect itself. And in doing so, it's going to create these neural structures so that we can react quicker the next time. The dysfunctions of the hypothalamus would be related to stress disorders. Not only these stress disorders, but over time, they're going to then affect the immune system, so we're now going to have immune dysfunctions. Once our immune system is broken down, we're now going to become much more sensitive to our environment, and we're now going to develop things like chemical sensitivities. On top of that, based on this limbic system being hyperactive, we're going to have things as considered as mood swings, depression, and anxiety. Over time, pain can develop from an overactive limbic system, so now that we have pain in different parts of our body, that we really don't know a reason for that. And we also know that in the presence of cortisol, which is a stress hormone, it will also heighten the stress response of that hypothalamus, and eventually through all this activity going in our brain, our nervous system, and our endocrine system, we eventually get to a place that we become weight loss resistant. In other words, our clients cannot lose weight, and then that metabolic syndrome becomes a part of life, certainly creating inflammation within our body, creating a much worse problem than we originally started with just a stress disorder. So, emotional protection. Our brain has now become wired to react emotionally as a child instead of as an adult. Emotional protection, we are stuck at the earliest place of wounding within our brain. And that's why those early childhood traumas can be so apparent and so important to deal with when it comes to an adult who has health-related issues. Now, anything similar to that emotional feeling from the previous trauma, the thalamus will be on alert to send a signal to the hypothalamus to now react. And that's the job of the hypothalamus, is it runs a software so that we now can react quicker and faster for greater protection. We escalate our stress response because this now becomes familiar territory. Let's talk about the last principle of QNRT, and that is the brain connects and coordinates all the tissues in the body. If in fact our brain is almost like the master computer, everything that occurs within our body is communicated to not only from a cellular level but also from a brain science level. Our brain is highly involved and active with all the processes that are going on within our system, and that mainly includes many of those subconscious aspects that we're not even aware of. So if we take a look at chronic pain, we're going to see and learn in QNRT how to map out the brain. And in those areas, we may find that in this central motor processing of the brain is where chronic pain resides. And the emotional stresses that may be related to that may be resentment, anger, or critical loss that could have occurred in that person's life. And so through the process, we're going to map out and know how to diagnose what part of the brain is out of balance to help it get back into balance, and we will be dealing with these emotional stresses. We can look at the thyroid, and this is in the premotor frontal cortex. And in this case, we will find emotional stresses related to powerless and out of balance. Remember, we talked about how visceral responses were very much related to emotional stress that is not dealt with. And if we look at different parts of the brain when it comes to digestion, the colon right here is dealing with those things related to indigestible anger. That anger that we just stuff down into our gut and unable to digest will cause problems within our digestive system. So what can be done? This is our presentation as it relates to quantum neuro reset therapy. This is a therapy that is a proprietary protocol designed to initiate a neuroadaptive shift within the body by helping the brain recover from the stress caused by adverse emotional experiences. The fact is that we don't really even know our clients to that level and degree of what actually might have been their biggest trauma in life. But with the QNRT system, we're able to bring that forth in such a way that we have a method using these neurological principles to find ways to reset the brain so that they now can recover from that stress that has not had a chance to prior to them seeing you. QNRT helps the brain become more balanced, less stressed, and unburdened by the negative life stresses and patterns that lead to physical symptoms and high-risk behavior. It all starts in the cerebellum. If we go back to the slide and we were talking about that second principle of how brains were hardwired at birth, we know that the cerebellum is going to pick up most of all the sensory information or sensory input that we receive in a day. Our cerebellum becomes highly active. It is the oldest part of the brain, as it sits right back here at the very back below portion of the brain, and it has a lot to do with the function of our body. It has to do with posture, balance, coordination of motor movements, basic aspects of memory and learning. But in QNRT, we also develop the emotional zones of the cerebellum. And in that case, we are dealing with these emotions of feeling unbalanced, feeling unsure, feeling victimized, oversensitive, and unsafe. The cerebellum is that first line of defense that if it feels under attack or feels that that information is going to create a harmful situation, it's now going to have direct connections into that limbic system so that it can not only create a memory but also deal with that situation in an automatic way. It's just unfortunately that automatic response may not be the best choice for that client and for ourselves to have a healthier and happier lifestyle. The cerebellum is known as the little brain and is located, as we said, in the back of the brain. It receives responses from various parts of the brain and directly handles visual and auditory functions. It modifies and improves the motor responses originating in the brain and makes the movement smoother and seemingly effortless. It helps to regulate the balance of the body. Most of the sensory information passes through the cerebellum, as we discussed in earlier slides, and it's also the oldest part of the brain, so it's also where the earliest wounds are found. If it's the oldest part of the brain, then we know in those childhood traumas, it's also where those traumas can get stuck and locked in that part of the brain. So now, as a board-certified QNRT practitioner, to do that, you'll need to complete 3 seminars, and each of those 3 seminars is going to break down the brain in such a way that we can learn how to test and how to find that brain imbalance and what is that correlating tissue that is related to that stress event. And in that process, we will also be able to tell all aspects of that emotional stress so that we can help that client progress to a healthier lifestyle. So you'll be able to evaluate the brain for balance through highly specific functional neurological tests. It will not take expensive equipment to do this. Many of the tools that we use are very inexpensive, and you probably already have them in your office right now. In the learning process, we'll also learn how to determine those affected areas in the body as it relates to that brain location. That's extremely important, because if we can find that part of the brain that is stressed, then we're also going to be able to find the specific areas and specific reflex points that we need. Through this evaluation, we'll be able to determine those specific reflex points on the body to determine what type of adrenal stress that is apparent, because the adrenals are highly involved in the aspect of any emotional stress. We'll also be able to look at the state of the nervous system and determine whether it's over-aroused or under-aroused or unstable, and many other aspects of this, because this is important to know what framework the nervous system is under based on this emotional stress. We'll also know the type of conflicts. For example, is it a physical conflict, so now the client is physically breaking down when they're dealing with this stress? Or is it an emotional conflict or a relationship conflict? Through our specific reflex points, we'll be able to know that. What specific age and emotional event occurred that we can identify for the client, and what subconscious beliefs have they now become congruent with based on that situation. The beauty of this system is this, that through the evaluation, through testing different parts of the body, we now will have enough information to sit down with that client and say specifically what that stress event is. We'll be able to identify what age it occurred. We'll be able to identify also with whom it occurred, and we'll tell the client all aspects of that as it relates to their physiology. The amazing thing is clients are amazed that we know that much information, and yet we know very little about the client's life other than the fact that we can read this system and determine it. And the beauty of it is that clients will really understand that you know what's going on because you'll have identified that situation without them ever telling you. QNRT is not a talk therapy. It is a neurological reset therapy that allows us to reset the brain, the nervous system, and the body so that that client no longer has those hindrances so that they can continue to improve to this system as well as any other protocols that you may be using within your office. As a QNRT certified practitioner, you're also going to learn how to use the limbic system and other neurological reflex to change the brain's perception and facilitate balance. That's one of the most important things that we do in QNRT is learn how to balance the brain, because most of our clients are not balanced, and hence the reason why they're having some health struggles. We'll also be able to identify the inflammatory markers and find the associated emotional stresses. One of the most amazing things as we learn in QNRT, there are specific emotional stresses that relate or resonate as specific inflammatory markers. So what comes first? It's hard to say. It can very much possibly be that an emotional stress is creating that inflammation problem within the body. We have many practitioners that we've trained that are now working with autoimmune issues like the thyroid and able to identify those emotional stresses and lessen and bring down those inflammatory markers. So now the client is responding to traditional treatment, which may be diet, supplementations, and or even sometimes medications. Also, we'll find those unwanted subconscious belief patterns holding our client back. We don't even realize it sometimes, but our clients may be holding on to belief patterns as unworthy, unlovable, abandonment, these type of particular patterns that can be so stuck within the limbic system that they're actually unable to really move beyond that because that subconscious belief pattern was developed at such an early age. It just kind of resonates in their life. And we have methods and ways to identify it and also help that client resolve those issues so life becomes easier again. We enhance your abilities as a practitioner because now you're going to be able to handle that one big giant stress, which was that emotional stress, as the cause or at least contributing to most of people's ailments, according to the other statistics and the other research that's been done. To have that ability is going to completely change your practice in such a way that you'll now be able to identify those clients who you can really tell need this type of work. You as a practitioner have other tools to help those deep-seated problems as well as maybe current stresses to avoid later things in life that that client might experience. We feel that this fits in with any current system or any other health protocol that you may be currently using. Listen, as healthcare practitioners, we all have different things that we use, and it's not easy, trying to figure out our clients' problems. The good news is QNRT will give you that one extra tool to be able to handle maybe that one thing that you're not really knowing how to deal with, and yet now being able to handle those stress patterns with your clients is going to make your work easier. QNRT will facilitate and do a lot of hard work for you so that all the other skills that you know now will be put in place, and so that your client, and our ultimate goal is with health practitioners, is provide the right type of service and to help our clients in such a way that they're going to get better. And it makes practice easier because your practice is going to build on referrals. We have again trained many practitioners, and one of the things that they constantly say is once they start QNRT and practice QNRT within their practice, that their referral rates go up. And all of a sudden their practices, and some clients or some practitioners have doubled, even tripled from what their current volume was. We're not teaching this in a sense that it will do that, but we know that if you help clients, people will refer because of the service that they received. We hope this was helpful in having a better understanding. We did cover those 3 basic principles of QNRT as related to how our brain and our nervous system will adjust its physiology based on those concurrent beliefs. We also learned that our brain is hardwired at birth from the limbic system, and we also learned that different areas of the brain control different areas of the body, and those stresses have specific emotional stresses that we can identify. In our system that we teach you in the first 2 seminars how to go through and identify all those brain areas and also identify all those emotional stresses. We also, in those first 2 seminars, will teach you how to deal with what we call negative life patterns and core drivers, those things that are holding our clients back from getting better. In Seminar 3, we go through all the inflammatory markers and how to deal with those stresses that clients are either being exposed to, their sensitivity levels, and their immune system that is breaking down. We teach you how to reset those areas in the brain through the limbic system and other neurological reflexes, and we feel that you will benefit and your clients will also benefit by you learning this system. To get more information, you can go to our website at QNRT.com. On the website, you'll find more information you can read about. You'll also look at our seminar schedule. Our office is located in Roswell, Georgia, which is just north of Atlanta, easy access by plane and car. We do hold seminars here throughout the year, and we also travel to different states. So check our website out for that information. Also, you can call this number right here, 770-993-7330, if you need some more information or any other questions. We're here to help you. I appreciate your time and listening to this presentation. Hopefully we answered all your questions, and we're looking forward to seeing you at our next seminar.